Welcome to This Explainer. Today we're diving straight into an evidence-based clinical guide tailored specifically for you, healthcare professionals, clinicians, and informed practitioners. We are looking at one of the most heavily researched therapeutic supplements on the entire planet, creatine monohydrate. We're going to cut through the internet noise, separate the rigorous science from the myths, and give you the exact tools you need to safely guide your patients.
Here's a quick look at our roadmap for today. We'll start with the science of safety, then move into kidney health and monitoring, debunking dehydration, brain health and neuroprotection, and wrap up with dosing and product purity.
You know how it goes. Patients walk into your clinic with a lot of hesitations, usually fueled by outdated anecdotes or some scary blog posts they read online. But we can immediately validate and disarm those concerns. A comprehensive narrative review in Frontiers in Nutrition looked at over 30 decades of accumulated clinical safety evidence. Their conclusion? Creatine monohydrate is safe for most populations. We literally have over 30 years of hard empirical data to stand on here.
All right, let's jump right into part 1, the science of safety and evaluating the evidence. We'll take a broad look at the most common safety queries you're bound to encounter during consultations.
So let's tackle the big questions right away. When patients express concern over cancer risk, you can confidently tell them that increased carcinogenicity is simply not supported by human studies. What about kidney function? Again, totally safe for healthy individuals. Now, clinical populations do require non-creatinine monitoring, and we'll get into the specifics of that in just a minute. Finally, gastrointestinal distress. Okay, this is the one area where some risk is actually present, but it's entirely dose-dependent. It really only happens with massive single doses over 10 grams, and it's super easy to mitigate just by splitting those doses up. Having these facts ready gives you a really clear, calm way to show patients that their major systemic fears are just unsupported clinically.
Now, this one is wild. There is a massive contrast between the anecdotal fears and the clinical reality regarding cancer. The popular myth out there suggests that combining creatine with high-heat cooking forms carcinogenic compounds, heterocyclic amines, or HCAs, which supposedly supports metastasis. But the actual fact? Human studies tracking high-dose supplementation show it does not stimulate the formation of these mutagens in the body. Actually, scratch that, it's even better. Emerging evidence shows that creatine enhances CD8 T-cell anti-tumor immunity. It acts as a direct energy source for your immune cells and has been shown in models to actively inhibit tumor growth. It's a complete paradigm shift. Researchers are literally exploring it as an adjunctive anti-cancer therapy right now. Moving on to Section 2, kidney health and monitoring, specifically looking at protocols for pre-existing conditions. This is often the most pressing concern for patients with metabolic issues. So patients frequently read reports warning them about kidney stress. That brings us to a really critical question. How do we accurately monitor patients who already have pre-existing kidney conditions during supplementation? If someone sitting in your office has hypertension, diabetes, or a reduced GFR, how do we keep them completely safe?
To protect these patients, you're going to want to follow this step-by-step checklist. Step 1, you absolutely must avoid using serum creatinine as your primary biomarker. Why? Well, because supplemental creatine naturally, non-enzymatically degrades right into creatinine at a rate of about 2% a day. So, a patient taking creatine will naturally present with higher serum creatinine levels completely independent of their actual renal function. To avoid a terrifying false positive diagnosis of kidney failure, step 2 is to utilize alternative biomarkers. Think cystatin C or a 51CR EDTA clearance. And then step 3 is simply to assess proteinuria and albuminuria. Using this alternative protocol ensures highly accurate biological monitoring without causing any unnecessary panic.
Next up, Section 3, debunking dehydration. Let's talk about muscle cramps and fluid dynamics.
You've probably heard this a million times from athletes or active older adults. Doesn't creatine dehydrate you? Well, controlled studies completely flip the script on this myth. The anecdotal fear is that it causes dehydration, heat illness, and severe muscle cramping. However, the clinical data proves these claims are completely unsubstantiated. In reality, because creatine draws water into the intracellular space of the muscle cell, it actually assists in maintaining thermoregulatory balance. It can even reduce the incidence of muscle cramps in exercise settings. So you can confidently assure your patients that they are physiologically supported, not hindered, when it comes to hydration.
All right, Section 4, brain health and neuroprotection, where we are expanding our therapeutic horizons. Let's transition from dismantling myths to exploring something truly fascinating.
To really grasp why this works for the brain, we have to look at the phosphocreatine energy shuttle. This is a mechanism that maintains cellular energy homeostasis
and ensures a super stable ATP supply. Now, the brain is an incredibly metabolically active organ, right? It demands a ton of energy. This shuttle is absolutely crucial for synaptic transmission and neural plasticity. Explaining this energy shuttle to your patients is a great way to help them understand how creatine isn't just a muscle builder. It's actively supporting brain energy metabolism and overall cognitive health at a fundamental cellular level. And researchers are incredibly enthusiastic about its neuroprotective potential across a whole range of neurodegenerative disorders. I mean, look at this. It mitigates neuronal damage, showing real potential to slow Alzheimer's progression. It prevents the loss of dopaminergic neurons in Parkinson's models. In clinical trials for Huntington's disease, a dosage of 8 grams a day for 16 weeks significantly reduced oxidative injury. Plus, even in perfectly healthy populations, it improves cognitive processing and reduces mental fatigue. The data here is incredibly compelling, especially for our aging patient populations. Finally, Section 5, Dosing and Product Purity. Let's get right into clinical implementation and build a toolkit you can use. For your standard dosing protocols in healthy or active populations, you'll generally utilize a loading phase of 20 grams a day for 5 to 7 days, followed by a simple maintenance phase of 3 to 5 grams per day. But for neurological or clinical populations, much higher doses are often required. We're talking up to 8 to 20 grams a day, as observed in several of those trials we just discussed. The absolute most important administration tip here: strictly advise your patients to split those higher daily totals into single doses of 5 grams or less. Co-administering these smaller doses with plenty of fluids is the proven way to completely avoid any of that gastrointestinal distress.
But listen, none of this matters without ensuring product purity. The safety data we've been talking about applies strictly to pure creatine monohydrate. You have to ensure the product your patient buys is verified by reputable third-party testing programs. Tell them to avoid alternative, unverified dietary blends or fancy new formulations. The adverse effects found in the literature are almost entirely linked to unapproved pharmaceutical or carcinogenic contaminants found in cheap, low-quality supplements, not the creatine molecule itself. Quality control is absolutely your first line of defense for patient safety here. So bringing it all together, patient reassurance is really built on these 3 main pillars: verified supplement purity, evidence-based dosing, and sound clinical biomarker monitoring. By grounding your patient consultations in these core principles, you can bypass all the internet noise and confidently guide them towards safe, highly effective therapeutic use, whether they're recovering from a physical injury or looking to protect their aging brain. I want to leave you with this final, provocative thought to consider as you implement these findings into your daily clinical practice and patient rounds. How will integrating these evidence-based monitoring protocols and purity standards transform the therapeutic outcomes for your patients? Thank you so much for joining me for this explainer, and here's to putting this incredible science into practice.